Hello, we are doing an informative presentation today talking about pink eye. So my name is Carl.
My name is John.
My name is Krenz.
And my name is Matt.
All good. And now we're going to proceed with the presentation. All right. Take it away, John.
So starting with defining the pink eye, also known as conjunctivitis, is when someone has shown signs of inflammation of the transparent membrane called conjunctiva. It usually looks like the lower part of the eye is pink and on some occasions red. The cause. What causes pink eye? Usually, pink eyes are caused by factors like infections such as bacteria, viruses, and some allergies. In some cases, there may be chemicals that were recently splashed in the eye, or there may be objects such as small rocks, dust, and other potential objects that can get into the eye. Signs and symptoms. Usually, when someone has pink eyes, there will be itchiness around that area. Like mentioned before, they may show signs of redness or pinkish color around that area. Patients can show watery eyes, or there may be some eye boogers present when they woke up in the morning. They may show signs of pain and discomfort. Slide. Incubation period. The incubation period for pink eye differs with what kind of infection the child has. For bacterial infection, it lasts around 3 to 5 days. Allergic cases usually last for around 7 days, and viral infections last from 7 to 14 days.
All right. Thank you, John. And now we are going to proceed with Krenz prevention.
Hi guys, so for my part, I'm doing transmissibility. So next slide please. So how contagious is pink eye? So there's three types of pink eye. There's viral, bacterial, and allergy. So conjunctivitis is highly contagious, both bacterial and viral, unlike allergic conjunctivitis, which is totally not contagious. So you or your child is contagious once the symptoms appear until there's still tearing of the eye or any discharge. Next slide, please. So how do we prevent it? So bacterial or viral pink eye can be spread just like other bacterial viral diseases. Pink eye is direct and indirect contact, but it can also be transferred by spread of the respiratory tract droplets. For example, like someone sneezed or coughed. The number one tip to prevent pink eye is by washing your hands. This will kill all the microorganism that is on your hand, which minimizes the chance you get being infected by pink eye. You can use a hand alcohol based hand sanitizers or a simple soap and water. Just make sure to wash your hands approximately 20 seconds. Also, avoid shaking hands or hugging or any physical contact with an infected person, because since it can be contact from another person, if you shake someone's hand and that person is infected, you could get infected too. So be careful. Next.
All right.
Thank
Thank you, Krenz. And now we are doing assessment. For parents, just look out for the signs and symptoms of the pink eye and also go to the doctor just to make sure. And then they were going to do some laboratory results, take some culture sample from your kid and then run it to the lab and then look at whether it's positive or negative for conjunctivitis. Moving on to interventions, there are a lot of remedies such as medications, such as eye drops that can be prescribed by a doctor or from a store. There are also cold compresses for pain and swelling. Always do hand sanitization or wash hands. Never touch the area for further irritation. Also try to isolate yourselves because it is contagious from direct to indirect. Also avoid further strains by not watching TV for a long period of time and avoid dusty places. Also, some people recommend wearing sunglasses such as um and then there are some videos actually that I'm gonna show you. Mm. Hi Lola, what interventions do you do back then when your children have pink eyes or red eyes?
Back then, in my times, whenever my children are having these red eyes, I just let them dip their face, submerge their face with a eyes wide open in a basin full of water. That's it. But nowadays, you know, um, it's very handy the treatment. You just buy these products, Vicin or Imo for red eyes. You just drop, yeah, drop 2 or 3 drops on both eyes, on the red eyes. And another thing, I just instruct them not to touch their eyes because it will irritate more. Yeah, that's it.
All right, thank you, Lola.
Okay.
Hi, I'm Caroline Glomar, mother of John Glomar.
What did you do when I had pink eye?
When you were a kid, when you had a pink eye, I just used a clean cotton cloth and put a cool water and do compress.
All right, that's all for interventions. Moving on to Matt.
I will be talking about the evaluation and its cure and treatment. So the patient will know they're getting better when their symptoms resolve over time. And in most cases, conjunctivitis is self-limiting within a short period of time. And that means it will be cured without any treatments. However, treatments can also be given depending on the type and severity. So for viral conjunctivitis, it is self-limiting and it lasts for 1 to 3 weeks. For the common bacterial conjunctivitis, it is self-limiting and it lasts for 1 to 2 weeks. And neonatal inclusion conjunctivitis is a bacterial type that's transmitted during birth from the mother. However, it is not self-limiting and it lasts for 1 to 2 weeks if treated and can persist for 3 to 12 months if untreated. And lastly, allergic conjunctivitis is self-limiting and lasts for 2 days to 4 weeks, depending on the type. And if the patient's condition does not resolve within this time, the patient should be referred to an ophthalmologist. Next slide.
All right, thank you, Matt. And just a reminder that this disease can reinfect a patient and can cause blindness, partial blindness, infection, or even permanent damage. If so, call 911 or go to the nearest emergency. That's all for today for Pink Eye, and thank you for listening.